My name is Sani Husseini and the coordinator to SFT Training Academy. Today, in our podcast today, we have an August visitor, Hajar Rahila Mukhtar. She's the Executive Secretary, KANO State Contributory
Healthcare Management Agency.
Healthcare Management Agency.
Yes.
She's on this platform today to briefly create an awareness on what her organization is doing to assist the general public on the issue of health issues. We all know that climate change is on the ground and everybody is having issues of health. So KSCHMA is here in KANO to assist the general public in accessing hospital affordably. So I would like to introduce Hajia so that she can briefly explain what KSCHMA is.
Okay. Assalamu alaikum wa rahmatullah. We are very happy to be here. I believe you are the CEO of this organization.
Yes, ma'am.
Thank you very much for inviting us. So actually, KSCHMA was established by KSCHMA Law number 3 of 2016 with the sole mandate of reducing hardship on residents of KANO State when they come to access healthcare. It is mandated to achieve universal health coverage. That is, all residents of KANO should be enrolled into the scheme of KSCHMA so that we will reduce out-of-pocket expenditure.
Yes.
So that if employees or residents of KANO go to the facilities to access healthcare, they wouldn't have to pay huge medical bills. You know. So as you rightly said, there is climate change issues around the nation or in the globally around the world. So this climate change poses a lot of health hazards or risk of predisposing individuals or residents to certain diseases. So as these diseases goes on the rise, residents will be posed with the challenge of having to pay for their medical expenditure. So what KSCHMA does, it gives a very soft landing. It gives a very good support for families to have relief when they come to pay for these medical charges. So if you are enrolled into the agency, all you will need to do is, if you go to any registered facility of your choice, what you will need to do is just to pay 10% of whatever charges have been placed in front of you.
Wow.
Moreover, we also have another arm of this scheme, whereby this we call the capitation, the other one we call fee for service. This is a prepaid, capitation is a prepaid services, while fee for service is a postpaid services. This, whenever you're posed with a situation of any disease or any illnesses and you need to go for a hospital admission that will range between 21 days, or you need to go for any surgery, you will just walk into that registered facility of your choice, request for a code, we will give an authorization code to that facility, and then whatever expenditure incurred in respect of that enrollee, the agency will pay in full to that facility.
This is awesome.
So really, it's a means of creating an environment whereby everyone will be able to afford his medical bills whenever he is faced with any illnesses or any challenges or any accidents.
Sure.
And then you see, when you talk about accidents or emergency services, these services for any enrollee, once you walk into that facility of your choice, you will not be charged anything. So you'll be attended to, you'll receive your drugs and everything.
Wow, this is really wonderful.
Yes.
It's wonderful.
Yes.
So thank you very much, Hajia, for this wonderful awareness that Hajia has just said to the general public. So we want to be glad to announce that our company also has joined this KSCHMA, and our staff are now fully enrolled in KSCHMA. And we want to thank you, Hajia, for this also opportunity.
Yes.
And we want to invite the general public also to quickly and hurry to enroll their staffs. Even if you don't have a company or office, you can enroll your family. This is an avenue for you to have access to a healthcare facility in an affordable way. We thank you very much, Hajia, for this wonderful.
You see what you are doing to your staff, you're really doing justice to them, because a lot of organizations are missing out from that concept of social health insurance. When you say social health insurance, that you pay a token, a just small amount of money, and then the rest is being covered by the government. But a lot of organizations have failed to understand the concept of social health insurance, whereby you just pay 11 to 12,000 for a whole year. Once you pay that, we have a benefit package, which I believe we have brought for you, for your staff to see. That benefit package covers a lot of services, whereby your enrollees will be very happy if they see those services we cover. And then we have, across the state, we have a widespread. We have around about 600 facilities. That is both private, primary, and secondary facilities. And then we are working on improving our services, because presently we only run primary and secondary services. So we have conversations around going for tertiary services with KANO Teaching Hospital. So once those conversations are in place, we are good to go. So, you know, a lot of people are missing out on this, but I believe once you start this scheme, you're going to like it, and then you're going to make more people to enjoy, because by the day, people are coming to the agency to register. Occasionally, we have to call for ad hoc staff to come in and help us to do some of the registration activities. People are becoming more aware. And as you said, climate change, a lot of diseases are coming up. Look at this flooding we're having. Most diseases will come. You see, we're now in the rainy season. There are a lot of malaria cases. If you see the number of cases we have treated for the past few weeks, you'll be amazed. So you can imagine there's inflation in the state, and then there are diseases on the rise. So KSCHMA is in between these two scenarios, and is really supporting residents, employees, and what have you, to have a very soft landing on their medical bills. You know, some diseases will pose you into a danger of going into poverty.
Exactly. So very true.
So you see, a slight, a bill presented to you can put you into danger. Recently, I've heard that most of the consultation fees have risen almost threefold. In some places where they used to charge 5,000 naira, it's now 10, 15, 20,000. So, but once you register with KSCHMA, you don't pay consultation fees in any of the facility, be it private, be it secondary, be it primary, in any facility of your choice. So I really commend you for taking this bold step, and I hereby wish to call on all other organizations to follow the footsteps of Sahcon Fumigation Center and enroll their employees into this scheme, so that they will be able to afford their hospital bills. They will be able to enjoy the robust benefit package we have in the agency. And I'm hereby inviting you to come to the agency, number 27 Sokoto Road, so that you can see for yourself what we have. And then we will take you around some of these facilities, which I said we have a very widespread across the state, so that you will see for yourself what we are doing.
Thank you very much, ma'am. Alhamdulillah, this is a very, very awesome and robust presentation Haji has just made, and it's very clear. So we please beg the general public to enroll their staffs, enroll the companies, so that you benefit out of this. From this moment now, we're going to say thank you very much for coming, and we wish to have you again in the second series, so that we'll be able to at least give a feedback on what we have done, on what we have. We personally, since we are now fully enrolled, we want to give back the feedback to the community, what our experience is with KSCHMA and even the private hospital we have obtained, so that at least the general people understand, yes, we have been part of it, and this is what we have come across. These are what our experiences, so that general people will understand the benefit of being part of KSCHMA. Thank you very much.
Thank you very
From
much.
Sahcon,
I assure you we will always come.
Thank you very much, ma'am.
Always
From
come.
Sahcon Information and Cleaning Services, we thank Haja for coming, and thank KSCHMA for all this wonderful effort they have been doing. Thank you very much, ma'am. You're welcome.
Thank you, sir. We're very grateful. Thank you.
Thank you.
It's a very good step.
Wallahi,
And I assure you will enjoy it. So